Lactoferrin is an iron-building protein and it helps to defend the body against microbial invasion. Lactoferrin is found in secretions like milk, tears, sweat, saliva, and digestive juices on the body's surfaces, circulating in the blood and in some immune cells. The protein is antimicrobial. It stimulates the immune response, reduces inflammation, and promotes wound healing. In addition, the ability of lactoferrin to reduce cancer initiation, growth, and metastases has been studied extensively. Bovine lactoferrin is often used as a nutritional supplement, mainly to support the immune system. Cancer onset and progression is associated with suppressed lactoferrin production. As an immune system modulator, the lactoferrin stimulates the anti-cancer immune activity, yet it may reduce inflammation in the tumour microenvironment. The other anti-cancer effects of lactoferrin include promoting healthy cell division and cell death, suppressing formation of new blood vessels by the tumours, and interfering with the ability of cancer cells to spread. The antibiotic, anti-inflammatory, and immune-modulating properties of lactoferrin appear active against Helicobacter pylori, a bacterium that can lead to gastritis, ulcer, and cancer. By scavenging free radicals and binding to iron, this promotes oxidation, and lactoferrin also prevents DNA damage that can lead to cancer. Studies in animals and humans indicate that lactoferrin may be effective as an adjuvant cancer therapy. In a randomized control trial, 104 people with precancerous colon polyps received 3 grams of bovine lactoferrin, 1.5 grams of bovine lactoferrin, or placebo for 12 months before the surgical polyp removal. At the end of the trial, in a subgroup of 55 participants who were 63 years old or younger, the polyps from those receiving the higher doses of the lactoferrin had grown less than the polyps from those receiving the lower dose or the placebo. In a mouse model of breast cancer, bovine lactoferrin enhanced the response to tamoxifen. Lignans are plant chemicals found in the fibres of almost all plants. They occur in the diet mainly in legumes and seeds, with flaxseed being an especially rich source. Lignans can act as free radical scavengers, and they're phytoestrogens, which means they're structurally similar to human estrogens. The lignans are converted into biologically active compounds known as enterolignans by certain gut bacteria. One lignan of particular interest for its powerful free radical scavenging capacity is found mainly in flaxseed, and this can reduce the risk of cardiovascular disease and metabolic syndrome, and it's been demonstrated to have several anti-cancer properties. Like all phytoestrogens, enterolignans can bind and stimulate the estrogen receptor in the body. Because they compete with estrogen for receptor sites and they're weak stimulators of those receptors, their effect can be anti-estrogenic or mildly estrogenic, depending in part on the level of estrogen in the body. Phytoestrogens also appear to have varying effects on different types of estrogen receptors located in different tissues. In addition, flaxseed and its enterolignans have been shown to reduce tumor formation and growth, to inhibit new blood vessel formation, and to promote cancer cell death. High intake of flaxseed or lignans has been associated with reduced risk of breast and colorectal cancer. Higher lignan intake may also be correlated with lower ovarian and uterine cancer risk. In addition, men with high blood levels of enterolignan, reflecting both lignan intake and gut microbial balance, have lower risk of prostate cancer. In a randomized control trial, 32 postmenopausal women awaiting surgery for newly diagnosed breast cancer were randomized to receive either a muffin containing 25 grams of ground flaxseed or a muffin without flaxseed every day from the time of their first biopsy until surgery, which ranged from 13 to 76 days. Post-operative analysis of the cancerous tissue revealed that tumour markers were reduced by 30 to 71% in the flaxseed group, and tumour cell death was increased. The researchers concluded that dietary flaxseed had the potential to reduce breast cancer growth. In a similar trial, 147 men awaiting surgery for prostate cancer were given 30 grams per day of ground flaxseed for about 30 days before surgery. Surgical tissue samples showed that tumour aggressiveness, measured by the number of cells actively dividing, was reduced as urinary levels of enterolignans increased. Regular consumption of high lignin foods might improve cancer prognosis. One study assessed the lignin intake during a 1 to 2 year period before cancer diagnosis in 1,122 women with breast cancer and followed their progress for 7 to 10 years. Among the participants who were postmenopausal, the women who reported the highest intake of lignans were half as likely to die for any reason and 71% less likely to die from breast cancer compared with the postmenopausal women with the lowest lignin intake. In another study in 1,140 postmenopausal women with breast cancer, high blood levels of 1-enterolignin were correlated with a high survival rate during 4 to 8 years of monitoring. Interestingly, in the study, the correlation between the likelihood of survival and the enterolignin level was significant only in the women whose cancer did not express estrogen receptors. A meta-analysis that included data from this and 4 similar studies concluded patients with breast cancer who had higher enterolignin levels were less likely to die from breast cancer or from any cause. Some breast tumours have high concentrations of receptors known as human epidermal growth factor receptor 2. Research into cancer cells and animal models suggests that flaxseed might enhance the tumour-reducing effect of an immunotherapy agent that's used to treat this type of breast cancer. Melatonin is a molecule produced by the pineal gland, a pea-sized gland located in the brain, as well as by cells in a variety of tissues throughout the body. Melatonin synthesis is affected by many conditions, including light exposure, food, stress, age, reproductive status, health status, and the use of medications. The molecule can act as both a neurotransmitter and a hormone, and it's demonstrated broad anti-cancer effects, such as reducing oxidative stress and the ability of cancer to grow and spread, and the formation of new blood vessels, as well as promoting cancer cell death and triggering favourable epigenetic changes. In clinical trials in patients with such cancers as primary brain tumours, colorectal cancer, non-small cell lung cancer, breast cancer, and brain metastases, researchers found melatonin in doses up to 40 mg per day worked well with conventional treatments or improved the quality of life when no other treatment was available. In 2 separate reviews of clinical studies assessing the use of melatonin during chemotherapy or radiation for the treatment of solid tumours, melatonin was found to decrease negative side effects such as fatigue and low platelet counts, improve response to treatment, and increase 1-year survival. Melatonin has a particularly well-studied role in protecting against breast cancer, altering estrogen receptor function. Melatonin has been shown in the lab to reduce the proliferation of estrogen-sensitive cancer cells. It may also reduce tissue estrogen levels by inhibiting enzymes involved in estrogen synthesis. In a small study in 14 women with metastatic breast cancer that was progressing despite the treatment with tamoxifen, the addition of melatonin to the tamoxifen led to tumour regression in 4 of the participants. Melatonin may stabilize cancer cell growth in part by resetting the cortisol circadian rhythm. In a trial involving 14 patients with advanced cancer cells who had no more conventional treatment options, 20 mg of melatonin was given nightly for 3 months. 6 of the 14 participants had a stabilization of their disease, and this effect was correlated with normalization of daily patterns of cortisol release. Through its strong free radical scavenging ability, melatonin may protect the immune cells from the damaging effects of cancer therapies like radiation. In addition, melatonin has a direct effect on immune cell numbers and activity, giving it great potential as an adjuvant therapy. For example, melatonin may complement the use of agents called checkpoint inhibitors, which are now used to treat some cancers that are otherwise difficult to treat, such as lung cancer and metastatic melanoma. Melatonin has also shown promise in combination with immune modulating agent interleukin-2 in patients with solid tumours and in those with blood cell cancers. In a controlled trial, patients with advanced or metastatic cancer treated with interleukin-2 plus melatonin were more likely to have a positive response to treatment and a higher survival rate at 1 year rather than those treated with interleukin-2 alone. Modified citrus pectin is a complex polysaccharide and is derived from pectin obtained from the peel and the pulp of citrus fruits. Through changes in the pH and temperature, pectin is broken down into shorter absorbable pieces. These can then bind to some cancer cells and possibly interfere with their ability to spread. They may also have direct toxic effects on cancer cells. In order for cancer cells to spread, the cancer cells need to bind together with other cells. Protein projections on the outer surface of cells allow them to stick to one another. This appears to cover the sticky projections on the cancer cells, so they're unable to bind to each other or to other tissues. Deprived of this ability to stick together, the cancer cells thus have a reduced ability to metastasize. In animal models, the modified citrus pectin decreased the metastases of several cancers, including breast, colon, and prostate. In one study, 7 of the 10 men with prostate cancer who took approximately 14 grams of the modified citrus pectin daily had a slowdown in the doubling time of their PSA levels. The slowing of the PSA doubling time represents a decrease in the rate of cancer growth. In another study involving 35 men with prostate cancer who took 4.8 grams of modified citrus pectin 3 times a day, the PSA doubling time stabilized or improved in 79% of the participants. Panax ginseng is also known as Asian red Chinese or Korean ginseng, and it's been widely used as a medicinal herb by Asian cultures for thousands of years. Panax ginseng has been shown to stimulate anti-cancer immune function, decrease inflammation, and inhibit the formation of new blood vessels. Ginseng may also improve the outcome in patients with cancer undergoing chemotherapy. In one trial, patients treated surgically for stomach cancer received chemotherapy with or without Panax ginseng after surgery. The overall survival rate 5 years later was 76% in the Panax ginseng group compared to 38% in the control group. Findings from these studies suggest ginseng may reduce metastases risk and increase survival. One of ginseng's main traditional uses is for building stamina and increasing energy. Several studies show ginseng decreases fatigue both during and after conventional cancer treatment. In a randomized trial in 53 people with different cancers, participants took either Panax ginseng at a dose of 3,000 milligrams or a placebo every day for 12 weeks. The participants taking the ginseng had markedly better physical and mental functioning. In a placebo-controlled clinical trial that enrolled 30 women who completed chemotherapy for ovarian cancer, the participants took red ginseng at 3,000 milligrams per day or placebo for 3 months. The women taking the ginseng had less fatigue, nausea, vomiting, sleepiness during the daytime, anxiety, and shortness of breath, as well as improved emotional functioning. A small trial enrolled 30 participants with cancer-related fatigue, and it found 800 milligrams of ginseng daily for 29 days led to improvements in fatigue, appetite, and sleep. However, ginseng may be less helpful at lower doses. A randomized controlled trial in patients with advanced cancer found 400 milligrams of ginseng extract twice a day for 28 days was ineffective for improving energy. A related plant, American ginseng, has also reduced cancer-related fatigue at doses of 2,000 milligrams. In addition, American ginseng improves immune function, and in one study, it decreased the risk of moderate or severe respiratory infections in people living with chronic lympholytic leukemia. Pomegranate, a fruit that's rich in antioxidants, has gained widespread popularity as a functional food, a food with particular health benefits. Pomegranate fruit, the juice and the extracts have been studied in relation to a variety of chronic diseases, including cancer. Pomegranate has been studied for its potential role in preventing and treating prostate cancer. Pomegranate extracts have been found to suppress prostate cancer initiation, proliferation, growth and invasion, and to inhibit new blood vessel formation and prostate cancer cell survival. Even the oil from pomegranate seed reduced malignant activities of prostate cancer cells in the lab. Synergistic effects between pomegranate components were identified by Israeli researchers who noted that chemicals from various parts of the whole fruit acted in concert to reduce the invasive ability of prostate cancer cells. Researchers have demonstrated that pomegranate polyphenols can induce epigenetic changes, leading to reduced activity of genes that are involved in the production of androgens, or male hormones, like testosterone, and the androgen receptor that many prostate cancers need to survive and to grow. In addition, scientists have found that pomegranate promotes cancer cell death in androgen-dependent prostate cancer cells, in part by inhibiting inflammatory signaling. In an important clinical trial, researchers studied men who'd already undergone surgery or radiation treatment for prostate cancer, but nevertheless had rising levels of PSA, the serum marker of tumour growth or recurrence. Men drank 8 ounces of pomegranate juice per day, and the researchers measured their PSA levels every 3 months for 33 months, calculated their rate of PSA increase, and established the time it would take for the PSA levels to double. A longer doubling time indicates slower cancer growth. The average PSA doubling time lengthened from 15 months, or 1.25 years at the beginning of the trial, to 54 months, or 4.5 years at the end. In a similar study, 101 men with rising PSA levels after initial treatment for prostate cancer received either 1 or 3 grams of pomegranate extract daily for 18 months. The PSA doubling time increased overall and by more than 100% in almost half of the participants. Both doses resulted in roughly the same benefit in the doubling time. Preclinical research suggests pomegranate extracts might be helpful for people with other types of cancer. Pomegranate seed oil, an extract from the oil, and a polyphenol-rich fermented juice have all demonstrated anti-cancer activities in breast cancer cells and animal models of breast cancer. These activities include suppressing the growth, the proliferation, and the new blood vessel formation. In addition, a pomegranate fruit extract enhanced the effects of anti-estrogen drug tamoxifen in an estrogen-sensitive breast cancer cell culture. Pomegranate seed oil and peel extract have been shown to suppress experimentally induced colon cancer and precancerous colon lesions in rats. In mice who were exposed to cigarette smoke, supplementation with pomegranate juice decreased lung nodule formation and a marker of tumour growth. Pomegranate fruit extract has also been found to reduce tumour growth in other animal models of lung cancer. Pomegranate polyphenols, known as alagitannins, are digested by gut bacteria into compounds with strong anti-inflammatory and oxidative stress-reducing effects. Breakdown products of pomegranate alagitannins have been shown to reduce inflammatory signaling and to promote cell death in colon cancer cells. These compounds may also suppress estrogen-sensitive breast cancer by inhibiting aromatase, the enzyme that converts testosterone into estrogen. Proteolytic enzymes are enzymes that break down proteins. Both mammalian and plant-derived proteolytic enzymes have been used in cancer studies. The use of some of these enzymes in adjuvant cancer care has received particular attention in Europe. One study found in a group of 2,339 patients with breast cancer, 55% had received proteolytic enzymes as part of their cancer treatment, along with standard chemotherapy, radiation, or surgery. The role of supplemental enzymes in reducing inflammation is well established. Studies have reported proteolytic enzymes taken during radiation therapy might reduce mucositis, or inflammation of the mucous membrane. This effect has been demonstrated in 2 controlled clinical trials involving patients receiving radiation from head and neck cancers, and 1 trial involving women receiving radiation for cervical cancer. However, not all studies have demonstrated this protection. Nevertheless, findings from a small preliminary trial suggest a combination of trypsin and bromelain may decrease elevated levels of inflammatory markers, including CRP in healthy adults. Higher levels of CRP have been associated with increased risk of recurrence in various cancers. 1 study examined the effect of proteolytic enzymes in people who were treated with standard chemotherapy for multiple myeloma. After a follow-up period of about 3 to 5 years, an approximately 60% lower risk of death was noted in those who supplemented their treatment with proteolytic enzymes for at least 6 months. In the most advanced cases, the median survival was 83 months with the proteolytic enzymes and 47 months without. A review of the effects of proteolytic enzymes in cancer care concluded that enzyme therapy can significantly decrease cancer-related and treatment-related symptoms like nausea, other digestive problems, fatigue, weight loss, and restlessness, and improve the quality of life. The effectiveness of proteolytic enzymes for increasing response rate and longevity in patients with plasmacytoma, a condition related to multiple myeloma, led to the inclusion of an enzyme product as an orphan drug, one intended for treatment of a rare condition, to advance the research into its use. For more information about herbs, supplements, and natural treatment plans, check out my website.